Not every patient's journey goes exactly as planned, but sometimes unexpected outcomes lead to surprising benefits. What happens when doctors advise against treatment, but a patient decides to take a chance anyway? Or when a patient vanishes for years, only to return with a life-changing story? Doctor, has there been a case where a patient didn't achieve the improvement they hoped for, but instead had other unexpected benefits?
Many of our patients have several concomitant diseases. And sometimes their main goal before admission to the clinic it is to improve one singular problem. But we always discuss several aims for our treatment. In some cases, there can be surprisingly better results in different diseases than in the main one.
For autistic children, the biggest issue for them is, of course, the speech. Most of children cannot speak, or they speak not proper words. So parents are expecting to have the improvement in speech. But we cannot guarantee the exact improvement in a specific child. So in this case, we usually say that we can look for different improvements, many of them, but we cannot guarantee the specifically speech. And we had cases when autistic children didn't start speaking from the first treatment, but they had multiple improvements in sleeping, in eating issues. They have reduced hyperactivity. They also had improvements in control, in how the way the seizures controlled. So parents of these children usually very happy to see these improvements, even if they didn't notice the specifically one that they were looking for.
You should understand that a lot of patients that we are facing are patients with genetical disorders, incurable diseases such as ALS, MS, Parkinson. And naturally, they really hope for a fix that it will cure them. Unfortunately, at the current stages of medicine, we cannot fix that. We cannot cure them from the diseases they are having, for those neurodegenerative disorders as an example. But in the same time, it doesn't mean that we cannot do anything about that. Some quality of life changes, better function, better muscle strength, less pain, less tremors, they can play a tremendous role in a day-to-day life and overall quality of life.
There was a patient who improved minimally with his joint symptoms, but his diabetes mellitus came under control, and he was very happy about this, as well as neuropathy, these tinglings in the legs, also it reduced significantly.
Some patients choose stem cell therapy even when their general practitioner doctor advised against it. Have you had cases when patients, despite that, decided to try stem cell therapy? What impacted the patient's decision?
Not all the doctors are familiar with the stem cell treatment. Some doctors are afraid to recommend it because it's the innovative treatment. They are not really sure about the outcomes. So most of the doctors would not recommend the stem cell treatment just because they never heard about it, they never tried it, and they are afraid. But sometimes patients still come to our clinic even if their treating physician doesn't like this idea. And when the patients have really positive, good results after the stem cells, some of the doctors change their mind and they start being interested in regenerative treatment. So this is our goal also, to popularize this treatment method and spread it all around the world.
So in most cases, if there are some concerns or suspicions from the general practitioners, we're trying to make a consultation with them too, to discuss the problems, to discuss the questions that they are having, and we can figure out how to proceed further, because you should understand that the stem cell therapy is not a substitute to conventional means.
There should be a combination of regenerative medicine and traditional methods of conventional medicine. We cannot replace each method with other. So combination is always works better.
Plus, it gives patients more psychological comfort when the overall medical team from their side and our side cooperating.
We have, first of all, very lots of autistic kids. Usually the doctors consider this completely untreatable condition. Yes, it is untreatable, but we can increase the independency. We can increase their speaking abilities, which can increase the interaction abilities of these kids. Also the same, for example, with rheumatoid arthritis, with inflammatory bowel diseases, even with multiple sclerosis, such a severe disabling condition.
Sometimes patients take time to share feedback on stem cell treatment. Why do you think this happens?
Well, this is actually expected. Again, the stem cell therapy does not work immediately. It's not like a pill that you use in hypertension to make it a little bit less. It takes time for the regenerative process first to kick in, then to do all the necessary work. So typically we see improvements in patients in a month and a half, 2 months period, give or take, depends on the condition itself.
The exosomes, these are purified biologically active substances produced by the stem cells. They are acting immediately, but there is a time needed for the body to respond on this.
For such situations, we use additional medications. We can use IMR therapy, we can use physiotherapy to improve the speed of the effect of mesenchymal stem cells and to make our patients feel better in shorter period of time.
Yes, there are some effects that they're starting to feel from the start, but those are usually non-specific, like energy levels and, for the lack of the better word, better vitality.
Patients who come for the stem cell treatment for the first time are afraid, they feel anxious, they do not really understand what to wait for, what the outcomes could be. So they are trying not to share their experience right after the treatment. They are waiting for positive changes. Usually they see the changes from 3 to 6 months after the treatment. And at that point, they usually arrange a consultation with one of our doctors, and they are happy to share us the positive results they have. And at this point, they also share the experience with other patients too.
Today, Swiss Medica's doctors share some of the most inspiring and unexpected stories from their practice. Behind every patient's story is a journey of hope, resilience, and unexpected possibilities. If you want to learn more about stem cell therapy and how it can change your life, book a free online consultation at Swiss Medica today. See you in the next video on Swiss Medica channel.